second episode of Treating Your Pain. Today we will be discussing different shoulder injuries. So we'll be focusing on one, which is bursitis. Bursitis is inflammation of the capsule in your shoulder, and it will really hurt when you perform this motion right here. It occurs with constant use of that with constant use. So it's known as microtrauma. When you constantly perform and use the same motion again and again, it'll eventually get inflamed and cause you a lot of pain. So we'll be looking at different exercises to help relieve that pain and other different ways to treat that pain. Cynthia will be joining us today, and she'll be performing the exercises with us today. And let's go. Hello, everyone. Cynthia will be helping us today.
Hello.
Thank you for coming in, Cynthia.
Thank you for having me.
Thank you. So we'll be starting the first exercise, which is great for bursitis, and it's known as the shoulder shrug. Now, with this exercise, it's very important to make sure your knees are bent. You are looking straight ahead. There's a little bit of a curve to your back, so a little bit bent. You're facing straight, good straight posture. You have the weights in your hand. Try to make sure the weights are up to what you can carry. Don't go overboard and don't keep it really light. And you just go ahead and shrug. 1, 2, 3, release. Shrug again. 1, 2, 3, release. You can perform this exercise depending on your tolerance. So with Cynthia, I would probably recommend an increase in weights, and I would have her do it 5-6 times. How does it feel?
Pretty good.
Pretty good?
Good support.
Good support. Excellent. So once you're done with the one more shrug, we're gonna go ahead and start the next exercise. Ready?
Yes.
All right, let's go and take these away from you. We'll put them right here. The next exercise is everyone's favorite, which is a basic push-up. Do you have any knee injuries I should be aware of, Sin?
Yeah, I think I'm pretty good.
Awesome. All right, let's go ahead and have you in the push-up position. Now, with this position, it is very important to make sure your wrists are not away from your shoulders. Make sure you are engaging your core. Make sure your knees are straightened and your toes are bent, and slowly push down. This is a really hard exercise. Now, there's multiple ways of performing it. One more time for me, Sid. Thank you. If this is too much, you can go ahead and perform a modified push-up, which is a push-up on your knees. Can you perform that for me? So you go ahead and get on the knees and extend your back a little bit more. So forward. Yes. And then go ahead and perform the same push-up. This is a modified push-up. This is great if a regular push-up is a little too much on the body. With any kind of exercise, you have to always protect your spine, always make sure your core is engaged. When we say your core is engaged, that means your core is tight. You can feel it tighten up, it feels strong. Make sure your wrists are in a safe position and that your elbows are comfortable. Thank you, Sin. Now for the third exercise, this is a really good stretch, especially if you're slouching on a desk a lot, which can easily cause bursitis, bringing your shoulders forward. There's a stretch that we call a doorway stretch. Okay. Let's have you go ahead and put one hand on the doorway. Bend at the elbow. So bend it like so. Yep. Go ahead and bring one foot out and slowly look away. Do you feel the stretch right in this chest area, in the shoulder area?
The stretch is right here on my shoulder and on the chest.
Perfect. So this is a great pose to really stretch the shoulder out, especially if it's a long day at work, you're at a desk, find any doorway and really stretch out. You can hold that position for 3, 2, 1. Excellent. Make sure you're breathing throughout. Excellent. Make sure your posture is correct. Make sure there's one foot out. If you go further out, you'll stretch the shoulder even more. With that, you have to make sure that your shoulder can tolerate that, so don't push it too much and injure the joint. Always go up to your tolerance. Do you think you can go ahead forward some more?
I sure can.
Excellent. Is this comfortable for
Very
you?
Comfortable.
Excellent. Go ahead and breathe through it. 1, Good. Now, it is vital that when you perform this exercise, you perform it on both shoulders. So what we would do is have Cynthia flip over, find the other side, yep. Go ahead and lean forward and look away, the other way. Excellent. And hold that position. 3, 2, 1, relax. Can you go a little deeper?
Sure.
Do you feel any pain or discomfort with that?
Feels great.
Excellent, thank you. Go ahead, hold. 1. Perfect. You can go ahead and release. Let's have you flip forward again. And thank you very much, Cynthia, for having you come by and do the exercises.
Absolutely. Thank you for having me.
Hi everyone, I hope today was very informative and helpful. Let's go quickly over what Cynthia performed today. So she did a shoulder shrug, she did a push-up, a regular one, and a modified one, and then she also performed a doorway stretch. With all of these exercises, it is vital to make sure your posture is correct, to make sure you're doing it up to your tolerance, and to make sure you're breathing comfortably and are in a safe space.